So, how can we improve? These are the elements of a transitional care model that I have identified as, if implemented, ways to improve the transition of patients, their care, their satisfaction, their outcomes. So, we can improve by implementing three components of the transitional care model. And those components, they call them screening, staffing, and fostering coordination. And for me, I've kind of identified them as screening is really just identifying and engaging high-risk individuals, flagging them, making this assessment part of a regular H&P that the provider takes when they see these patients. Staffing is developing a single point person across the whole episode of care. And I believe that given the weaknesses I identified earlier with the staff turnover and their dissatisfaction and the weak management, I think this should be a provider, and probably likely an advanced practice provider, not one of the physicians. And then finally, fostering coordination. We're going to be coordinating services with follow-up phone calls and patient portal reminders. So a follow-up phone call to say, hey, did you make your therapy appointment? When is it? And then check in with them a couple days after that appointment. How'd therapy go? Do you think you're going to have any problems with therapy? And then finally, when therapy is complete, call to make sure they have a follow-up appointment with the GI doc. I think those can really improve the practice and the patient's transitions and then ultimately their outcome.